Georgie Green is an 83-year-old woman. She has a history of hypercholesteremia, hypertension, and heart failure. She also has a recent history within the last 6 months of paroxysmal AFib. She was brought in by her daughter because she has been feeling dizzy, and she almost fell this morning due to her dizziness. She just had a cardioversion 1 week ago. Her vital signs and triage were 97.2 temp, 50 pulse, 16 respiration, blood pressure of 96/48, and her O2 sat was 98 on room air. We hooked her up to the heart monitor, and it still showed bradycardia in the 50s. Her blood pressure was 94/48, oxygen was 94, respiration rate of 14, and temp of 37.1 degrees Celsius. She does have a hematoma on the left wrist, which she says is painful as well. She's alert and oriented ×4. She has some edema in her ankles. I rated about 1+. She does have bibasilar crackles posteriorly. She went into torsades, and that lasted for a little bit, but then fixed itself, and she went back into bradycardia. Her heart rate was 56, and her blood pressure went down to 82/50, and that is when we decided to transfer her to the ICU. They did an EKG in the ICU, which showed QT or prolonged QT intervals. They also did a chest x-ray, which showed mild cardiomegaly and small bilateral pleural effusions, which could be evidence of heart failure. Her significant labs were a potassium of 3.1 and a magnesium of 1.1. The doctor ordered magnesium sulfate and potassium, which were both given. We are holding the amiodarone right now. The potassium went up to 3.5 after the potassium was given, and then magnesium went up to 1.5. She's still Brady, but she has not had any further episodes of torsades. She does have S3 present. I forgot to say that earlier. The edema is still present. The crackles are still present, and after putting her on 2 liters of oxygen via nasal cannula, her O2 is at 96, and her blood pressure is 98/56 with a heart rate of 56.